Alright, let's dive into something that's been making waves lately, and honestly, it's a topic that deserves way more attention than it's getting. We are talking about the state of mental health care, specifically the experiences of patients at Canberra Hospital's Adult Mental Health Unit, AMHU. Now, before we get into the nitty-gritty, let me just say this: mental health care is one of those areas where the stakes are incredibly high. We are talking about people at their most vulnerable, seeking help, and what they get in return can either be a lifeline or a deeper spiral. So, when I read about patients like Philip Cristallo saying they left the hospital worse off, it's not just a headline, it's a red flag that demands scrutiny. Here's the thing: Philip walked into AMHU looking for help after attempting to take his own life. You'd think, in a place designed to heal, he'd find compassion, support, and a path forward. Instead, he describes it as a fishbowl, a hostile environment that left him feeling trapped. Personally, I think this metaphor is spot on. Mental health units should be sanctuaries, not cages. But what Philip experienced, and what others have reported, paints a picture of a system that's failing its most vulnerable patients. And that's not just a problem for Canberra, it's a wake-up call for anyone who cares about mental health care globally. One detail that immediately stands out is Philip's allegation about being restrained and sedated without explanation during an argument over a knee brace. Now, I'm not here to judge the staff, I'm sure they're under immense pressure, but this raises a deeper question: how do we balance patient safety with dignity and respect? Restraint and sedation should be last resorts, not go-to solutions. And the fact that Philip had an allergic reaction to the sedative, which he claims was ignored for 15 minutes, is just unacceptable. What this really suggests is a system that's more focused on control than care. And that's a dangerous place to be. What many people don't realize is that premature discharge is a recurring theme in these stories. Philip says he was sent home without proper paperwork, and when he later requested it, there was no record of his allergic reaction. Emma Ford, whose 16-year-old daughter was admitted to the adult ward, echoes this. Her daughter was discharged without follow-up care, only to be readmitted later that night. From my perspective, this isn't just poor management, it's negligence. Mental health care doesn't end at the hospital door. It's about ongoing support, and when that's missing, patients are left to fend for themselves. And that's not just tragic, it's preventable. Now, let's talk about the elephant in the room: children being admitted to the adult ward. The hospital has a dedicated youth ward, yet kids like Emma's daughter are ending up alongside acutely unwell adults. The official visitors report highlights that this practice can cause further trauma and worsen conditions. Personally, I think this is a massive oversight. Young people need age-appropriate care, and being surrounded by adults in crisis can be terrifying. It's no wonder they're being discharged before they're stable, only to be readmitted later. If you take a step back and think about it, this isn't just a logistical issue, it's a moral one. What makes this really interesting is the broader context. According to the Australian Institute of Health and Welfare, about 1 in 8 acute mental health patients in the ACT are readmitted within 28 days. That's a staggering statistic. And while the hospital spokesperson points to frequent acute episodes as a factor, I can't help but wonder, how much of this is due to inadequate care in the first place? In my opinion, readmission rates are a symptom of a broken system. And until we address the root causes, like understaffing, lack of resources, and a culture that prioritizes control over compassion, we are just putting a band-aid on a bullet wound. Here's where it gets even more troubling. Philip recently visited AMHU again to see a family member and said it felt even more institutional than before. He described it as feeling like a prison, not a place of healing. This raises a deeper question: are we designing mental health units to treat patients or to manage them? Because if it's the latter, we are doing a disservice to everyone involved. Staff and patient safety are non-negotiable, but there has to be a better way to create a therapeutic environment. What this really suggests is that we need a fundamental shift in how we approach mental health care, one that prioritizes humanity over bureaucracy. So, where does this leave us? Personally, I think the stories coming out of Canberra Hospital are a symptom of a much larger issue. Mental health care is chronically underfunded, understaffed, and misunderstood. But here's the thing: change starts with awareness. By sharing these stories, we are shining a light on the cracks in the system. And maybe, just maybe, that'll spark the conversation we so desperately need. Because at the end of the day, mental health care isn't just about treating illnesses, it's about treating people. And everyone deserves to be treated with dignity, compassion, and respect. Before I wrap up, I want to leave you with this thought: if you or someone you know is struggling, don't hesitate to reach out. There are resources out there, like Lifeline and Kids Helpline, that can provide support. And remember, your voice matters. If you've experienced something like what Philip or Emma described, speak up. Because the only way we'll fix this system is by demanding better. So, what do you think? Is mental health care in crisis, or is this an isolated issue? Let me know in the comments below. Thanks for watching, and until next time, take care.